the technology's improved. The catheters, I think, are smaller, as you've said before. The imaging is better. And so obviously the results will be better, just like we've seen in our end when we do robotic surgery. Our results are better than when we did open surgery for prostate cancer. So that's what I was really impressed by, is the low rate of having to get another procedure done. It was 16% in his experience, and then the safety. And then, of course, the sexual function, he was able to preserve sexual function in all these patients.
No, for sure. I think, a large group of your patients also, they might come in catheter dependent. They come in, they have a need to have a urinary catheter, Foley catheter. But what I really liked about his paper was it showed, I think, mid-90s, these patients were catheter free at 3 months, which is a huge deal, because a lot of these men, you don't want to be tied to having this, this catheter, and it significantly improves your life, especially if you're in that dire state where, you need a Foley catheter to be able to urinate. So I think that's also another key finding that was in the paper.
I would 100% agree, because when we have those patients who come in and they're in retention from the emergency room, or they've been referred by a rehab facility and they're unable to urinate, a lot of times they're not in great medical condition to undergo a TURP, or sometimes they're anticoagulated as well. And so, these are the patients we definitely want the catheter out. And to see that within 3 months, there's such a high rate of patients who are successfully able to get rid of their catheter and void again after their PAE, I think that is really big, because that has always been a troublesome area for us when we're trying to get patients catheter free, but their medical conditions are making it difficult for us to do, conventional surgery, for sure.